IGEPHA im Gespräch. Der Podcast der Austrian Self-Care Association. Welcome to IGEPHA im Gespräch, the podcast of the Austrian Self-Care Association. I'm Christina Nageler, the Managing Director of IGEPHA. In this season of our podcast, we embark on a global journey to explore self-care initiatives in various countries and assess their progress towards establishing a national self-care strategy. Such strategies play an important role in fostering self-care, and they align with the recommendations of the Global Self-Care Federation's Self-Care Readiness Index, which combines efforts to enhance self-care within a nation, empowering more individuals to take responsibility for their health. Today, we're crossing the Atlantic to Canada, where I'm delighted to have a conversation with Gerry Harrington, a self-care expert at the FHCP, the Canadian Self-Care Association. Welcome, Gerry.
Thank you, Christine. Happy to be here.
Before we dive into our discussion, let me provide a brief introduction to today's guest. Gerry Harrington serves as the Senior Vice President at FHCP and is an expert in consumer health. FHCP is the foremost Canadian organization uniting companies that offer access to the food, health, and consumer products that Canadians rely on daily. As a leader in evidence-based, growth-oriented policy, FHCP assists its members in promoting the well-being of Canadians, safeguarding the food supply, contributing to Canada's economic growth, and ensuring the sustainability of the healthcare system and environment. I'm eager to learn more about the Canadian Self-Care Association's dedication to enhance self-care in Canada. Gerry, in 2020, FHCP released a blueprint for a national self-care strategy. Could you please elaborate on the content of this blueprint and share the guiding principles for developing a self-care strategy in Canada?
We have been working in the area of self-care as a broad concept for over 20 years. So we started in the early 2000s looking at, we did some social research, focus groups and polling. And that really started a process of trying to understand how consumers, individuals, Canadians look at self-care. What is their frame of reference? How do they look at this? How do they see it fitting into their overall healthcare and their lifestyles? And that's something we've been working on, looking at behaviors, attitudes, and so forth for many, many years. By the time 2020 came along, now we had just merged as an association with the Food and Consumer Products Association, and we were looking at a sort of a fresh approach to the whole self-care file. And of course, that was exactly at the time that the pandemic came down. So in putting the strategy together, we really did sort of put it in that context. We looked at, how the pandemic put our already stressed healthcare system in a very, very difficult spot. There were huge challenges. And we saw, too, that very early in the pandemic, self-care was going to be a really, really important part of how Canada came through it. So we thought the timing was opportune to put together that broad scoped approach, what we call the blueprint for a national self-care strategy. And we felt it was really important to frame it around some concrete recommendations. So at the very top of that list of recommendations was to have a parliamentary study of self-care, to understand it, to put it in the context of the Canadian healthcare system, the benefits that it has for the healthcare system, but as well as the challenges in putting together an integrated self-care strategy at a national level. So that was the first part. And that is a tricky one for Canada, because one of the things that we struggle with is that healthcare in Canada is not a primary responsibility of the federal government. It is the responsibility of the 10 provinces and 3 territories. So that creates some challenges. We want to have a national discussion, but health policy is, for the most part, laid down at the provincial level. So we've tried to look at, well, what are the national elements? What are the things that are really relevant at the national level? And one of the first things we looked at was health literacy. And that was something that we saw as sort of a unifying challenge for all sectors of the healthcare system and for both the national and provincial levels of government. All of us with an interest in health policy have an interest in doing something about increasing health literacy, measuring health literacy, being able to check our progress on that front. So that was another key recommendation in the report. The third recommendation really brought us down to that same challenge of the provincial versus national priorities. The healthcare system is largely managed at the provincial level, but the regulation of these products and control over access to these products is at the federal level. So we've always had this challenge of the benefits being of self-care in terms of the economics. And we've done a lot of research to show how self-care reduces healthcare costs, how it can increase access to formal healthcare services when people really need it. And all of those benefits are really felt at the provincial level. But if you look at the Self-Care Readiness Index, you see that where Canada lags a bit behind some of our counterpart countries is more on the regulatory side, and that is at the federal level. So we've always had that challenge. And one of the key recommendations in our report is we know enough now to start taking action on the regulatory environment, to make these products more accessible, to make the system more agile, so that Canada, which in recent years has kind of fallen behind on things like Rx to OTC switch, and we've had other challenges in the regulatory sense. You know, one of the reasons, for example, that we put a heavy emphasis on health literacy is because we're in a world right now where Canadian regulators are very, very focused on label information and adding more label information, making that label information easier to read, and so forth. And we're getting into a world where those labels are becoming so cumbersome that we frankly think it's working at cross purposes. It's not helping people get the information they want because the labels are just too dense, too complex, and don't really align with what consumers are looking for. They want that top line information. Is this the right product for me? How do I use it? What are the risks? So we felt that there was ample evidence in place already to start taking action on the regulatory side of things. Then as we go along, some of the other factors that affect self-care. So in Canada, we have a socialized system of healthcare, and there are all sorts of built-in incentives in that system for certain types of care. So, for example, if you go to see the doctor in Canada, that is completely covered by the government. First dollar coverage, there is no private insurance, there's no co-pays, nothing of the sort. On the other hand, if you're self-treating, obviously that's out-of-pocket expenses. Then we look at the world of drugs and health products. And while we don't have a national pharmacare system that covers everybody, the vast majority of Canadians do have prescription drug coverage. So again, you have that sort of financial incentive that pushes more towards formalized care.
You don't have to pay for Rx products, not even a couple of Canadian dollars?
I would say probably in the range of 50% of Canadians don't have to pay anything. They have no first dollar costs at all. And for probably another 30% of Canadians, then there are some form of copay or deductible. So what that means is, and then there's 20% of Canadians who don't have much coverage at all for prescription drugs. So there's an imbalance there. There's an inequity. And for some people, self-care is the most cost-effective way. For other Canadians, it's the least cost-effective way to deal with. And so we need to examine what those factors look like, those fiscal, financial factors that guide decision-making. And some of them are indirect. So, for example, in Canada, in order for a private payer to include a product or service in their extended health coverage, that product or service really needs to be tax exempt. It needs to be eligible under the medical expense tax credit that we have in Canada. And that's true for prescription drugs, but it's not for OTCs. So you can't even really get private insurance to cover your OTCs in Canada. And again, it's that imbalance. So what we're saying to the government is all of fiscal incentives align on the formal healthcare system. We need to think about rebalancing that so that the fiscal aspect is more neutral from the consumer's perspective. So that was the fourth recommendation. And our final recommendation is measure. If we're going to do any kind of a self-care strategy, we need to have targets. We need to know, what does this look like? What does success look like? And we have to be constantly going back and examining that and seeing, are we making progress? Are new policies actually positively influencing the way people are using self-care? And is it leading to a more efficient healthcare system and a healthier population? So that, in a nutshell, is what we're trying to do with the framework. And it's something that we do not see as a short-term exercise, to say the least.
That's what it looks like. Can you tell me, on the one hand, what would be the advantages for the Canadian population if you get your blueprint done the way you wanted it? And what were, and I guess still are, your steps towards the different stakeholders?
So from the consumer perspective, the perspective of Canadians right now, there is a major preoccupation with the state of our healthcare system. So I would have to say, typically self-care is something that we know from polling. Canadians want to be more engaged in their own health. They want to have more control. So these things are true and probably have always been true. I think it's probably fair to say that it's more true today than it was 5 years ago. In fact, we've done polling to that effect. And there's a fairly steady increase in interest in managing their own health. But really, right now, one of the biggest factors is, addressing that anxiety in the Canadian population about their healthcare system. Canadians, because our big neighbor to the south, have often looked at healthcare as one of the really distinguishing features of being Canadian versus being American. In that we have a cradle-to-grave system that has provided a great equalizer. And it was a huge point of pride for Canadians for many years. In some respects, I would argue that we got too caught up in that and started thinking that, the only alternative to a system like the Canadian system was the American system. When in fact, if you look across Europe and around the world, there are all sorts of universal healthcare systems that operate differently and offer opportunities. So from the Canadian perspective, I think it really boils down to, yes, having more control over their own health, but also taking pressure off the healthcare system so that it's there for them when they really need it. And right now in Canada, there's real anxiety about whether or not the healthcare system is going to be there for them when they really, really need it. Wait times are very, very high, to the point now where we know it's really starting to affect outcomes. And so there's more of an urgency from that perspective. When we talk to stakeholders about the self-care strategy, that's a big, big part of the message. One of the reasons why I think if you look at the way we talk to, for example, medicine today versus the way the conversation went 20 years ago, medicine was reluctant to think of self-care as a really important way to move forward. partly because I think there was still the belief that, a really strong relationship with the family doctor was the overarching key to good health. And that remains true. But I think now, even in medicine and the other health professionals, and even in institutional settings like hospitals and so forth, I think there's greater recognition that unless we start doing something differently, those kinds of services, those dimensions of the healthcare system are very, very vulnerable. So we do put a lot of emphasis on that. And we put a lot of emphasis on this is not just about self-medication. So if I look back to, and I've been working with the association for over 30 years. And if I look back to the way we talked about this 30 years ago, we talked about responsible self-medication. We didn't talk about self-care. It is really, really key that in our recommendations here, we look for those common points that affect the entire healthcare system. So things, health literacy being probably the best example. By talking about the 7 pillars of healthcare, so everything from hygiene to diet, exercise, risk avoidance, mental health awareness, and yes, use of products and services like OTCs and NHPs. So it was really, when talking to the broader stakeholder environment, it's really about, this is not just about OTCs and it's not even just about medication. It's really about empowering people to make better choices, to have better access, to be more in control of their own health.
So your blueprint was accepted by stakeholders, would you say?
It's part of an ongoing conversation. So yeah, we found, in some sectors, there was really strong alignment fairly early on. I think pharmacy very, very much does see that as an important part of moving forward with healthcare in Canada. We see at some government levels, for example, the government of Quebec, somewhat ironically, because very often the government of Quebec aligns itself more with the French way of thinking about healthcare and self-care. But nonetheless, in its most recent series of healthcare reforms, the province of Quebec, which accounts for about a quarter of the population of Canada, has said that the front line of the future in healthcare is very much around self-care, the pharmacy setting, the multidisciplinary approach to providing healthcare to Québécois. And so we're seeing steps along the road and more stakeholders finding where this aligns with their ambitions.
So are your argumentations already found in any political driven perspectives or?
Yeah, there's a couple of places where I think it's most notable. I use the example of Quebec, but there are also things happening at the federal level. So since 2016, so as I say, the blueprint for a national strategy was only launched in 2020, but we've been working on this for a long time. In 2016, the federal government, our regulator, announced a self-care framework. Now, this was because in Canada, right now, OTCs, non-prescription drugs, and natural health products, which in the rest of the world may be thought of as supplements and that kind of thing, vitamins and minerals and so forth, they're regulated under 2 completely separate sets of regulations. The OTCs are under the same regulations as prescription drugs. Natural health products have their own regulatory framework. So the self-care framework was recognition by the government of Canada that, look, people use these products the same way for the same purpose. It is in the practice of self-care. We need to have a regulatory framework that treats them consistently on a risk basis. So that's a project that we've been working on for 7 years now. It started in 2016 and it's moving forward. Another example I'd use, I made reference earlier to pharmacare. So in Canada, we do have universal doctor care and institutional care in hospitals and so forth, but we don't have a national system for drug insurance. When our parliament was debating the creation of a national pharmacare system, one of the reports out of the parliamentary committee that studied it said that one of the things that really needs to happen to make an affordable national pharmacare system is to have more access to OTCs, particularly in the form of Rx to OTC switch. And so they saw that as something that would enable pharmacare. So there is a recommendation on the books, and there is a national committee that is looking at fixing some of those problems around Rx to OTC switching in Canada. Really complicated because, again, that's where the federal and provincial governments interact.
What would you say? Which point of your blueprint are already in progress and which are far away from being in progress?
Well, we've been making some progress, again, on the regulatory side with the framework. I'll be honest, the pandemic kind of interrupted that. So I think we were no different from most jurisdictions where all of the oxygen in healthcare circles was being taken up with the response to the pandemic, and rightly so, of course. And at the same time, new priorities emerged because of the pandemic. So, things like supply chain difficulties, drug shortages, etc. All of the debates around vaccines, around pharmacotherapy, around masking, we weren't immune to all of that. So it really slowed progress down. As we speak right now, it's back in the political sphere. So in just the last week, I've testified in 2 separate parliamentary committees to talk about the self-care framework and how it needs to be back up at the top of the government's priorities. And we're making some progress there. So I think that's probably the most overt part of the success so far. I think where we're most anxious to make some progress is around health literacy as well. Ironically, I think there's a lot of alignment amongst stakeholders about the importance of this, but launching a national discussion and a national strategy around health literacy is I think, something that's more urgent than we've seen in terms of action so far. So we do think that that's probably the next major step forward. And that addresses both, the idea of empowering the Canadians, but it also addresses, some of the challenges as an industry we face. And that is, how do we get these more complex products that we know can make a difference in healthcare, in self-care? How do we make them more accessible? And is it really possible to make as much progress as we'd like to without moving the needle there on health literacy, giving people more tools? That doesn't necessarily mean arming them with knowledge per se. It's about arming them with the right tools so that they can find the answers they need and make the right decisions they want to make.
What tools do you think of when talking about tools? Do you have something in mind?
Yeah, I think, there are a few things. When we look at the Self-Care Readiness Index, amongst the things there were how much in the health professional sphere, how much time is spent on providing, the guidance tools to patients. I'll give you an example. The Canadian Diabetic Strategy, which was something that was launched a couple of years ago, has a really big component around how to support health professionals educating their patients about, the management of their disease, giving them multiple tools. And so there we're talking about a role for health professionals. The other major way, I think, is to look at the role of digital. In our world right now, we're still stuck with trying to cram all that information in those cardboard boxes and bottles, which we've been doing since the 19th century. In 2023, we really need to be making better use of digital. And what does that look like? So in 2018, we gathered a group of experts in pharmacy, communication, knowledge translation, from all across North America, to look at, what are the tools you would need to better empower people and create more informed use of these products. And, the labels were well down the list. It was more about things like decision-making tools, So those could be things that are shared with health professionals, as I described in the case of the diabetes strategy. But also, the role of apps. So really exciting to see our neighbors to the south talk about what they're calling ACNU. And that is, I'm going to forget what the acronym stands for, but what electronic components, what additional tools could you offer in a product that would make it viable for self-care when just the plain old label wasn't going to turn the trick. Additional conditions for non-prescription use.
Okay.
So additional conditions for non-prescription use is a really exciting concept, because what FDA is saying is to industry, show us what additional ways you could support the use of a product beyond simply labeling and advertising. So we look at the possibility of apps, we look at the possibility of online tools and so forth. These are exciting concepts, and it strikes me that most of us do all sorts of things ourselves using those kinds of tools. Everything from managing the finances to just such a wide variety of functions that used to be done professionally for us, that we can use electronic tools to manage ourselves. We've made really little progress on that, on the healthcare side and the self-care side in particular. So that's I think the kinds of things that they were looking at. Other things really just comes down to simplifying, really thinking about what is the essential information that consumers will absorb, are engaged with, and will use to follow the product, instead of offering them essentially a booklet to go through. And we know that consumers will bypass that. To again draw the parallel with digital, it's like when we download a new app or we download some other service online and we get that legal liability waiver. We never read it. We just click yes and carry on. We can't continue doing that with these products. There needs to be simpler, more effective messaging.
Well, thank you so much for your insights on the state of self-care in Canada. To wrap it up, could you share some recommendation for us here in Austria? What should we definitely consider when planning a self-care strategy?
Well, I think the common challenge we all have is the healthcare field is full of competing priorities, and there are lots of really good competing priorities. And so recognition right away that no one sector can really move the needle on healthcare or on self-care. So the first step really is all about finding those common elements, identifying, those changes that we're pursuing that would resonate for other stakeholders in the system, framing this, not just in terms of, growth of our sector, but framing it as creating a fairer, more sustainable, more robust system for the benefit of consumers. Data. We need to be able to make the case, and in a credible way, that these individual decisions on self-care will yield benefits to the population and to the public purse, for that matter. So it is really, really, really key that we move forward with evidence. And this is where I think the Global Self-Care Federation has done us all a great service by providing this set of common global measures that we can compare jurisdictions against, and to really, really dig into that. And eventually, I think that will lead to an easier narrative for us to share in our national jurisdictions in Austria and in Canada, elsewhere, simply because we're talking the same language and about the same key milestones.
Well, that's true. Thank you, Gerry, for your insights into the Canadian healthcare system and the self-care system. Thank you so much for being here.
It's been my pleasure, Christina, and thanks for your interest.
It's clear that self-care is a crucial concern in various countries. In Austria, IGEPHA is dedicated to further emphasizing the importance of self-care. If you'd like to explore the benefits of self-care or learn more about IGEPHA services for companies in the self-care industry, please feel free to reach out to us at office@igepha.at. Until next time, thank you for tuning in, and we look forward to seeing you on the next episode of our IGEPHA podcast.